Welcome to Muscle Research Review for the week of June the 15th, 2015. Quick research summaries for the very busy health and fitness professional. So let's begin. How many have heard of palm cooling to reduce fatigue and improve exercise performance? If you haven't, there is a good chance you'll be seeing more of this. Now, a new study examined palm cooling at 15 degrees Celsius between sets. They found it hastened heat removal and blood lactate clearance and delayed power decrements. Now, looking at the trend, we can go back to an article in 2010 that found palm cooling from 35 to 20 degrees Celsius temporarily overrides fatigue mechanisms during intense intermittent resistance exercise. In 2013, a study found palm cooling and palm heating actually increased total exercise volume in resistance exercise for women. Now, the study that really got everyone excited was starting back in 2012. Palm cooling was applied for 3 minutes between sets of exercise and increased work volume by 40% over 3 weeks of bench press training and increased work volume over 144% over 6 weeks of pull-up training. Now, there is also an increase in strength training of 1 rep maximum of 22% over 10 weeks in pyramid bench press training. Now that the palm cooling products are released to the general public and used by professional sports teams, it should be interesting to see where the real world feedback coming. Now, do you use palm cooling right now? If so, what's your experience? If you're evaluating athletes for groin pain, a new study assessed the factors that differentiate athletes with hip and groin pain from those without. Here's what you need to be looking at. The systematic review looked at 2,251 articles, of which 17 were selected and 10 were high quality. The study found that in those with hip and groin pain, there was lower patient-reported outcome scores, pain on the adductor squeeze test, reduced strength on the adductor squeeze test, reduced hip internal rotation and bent knee fallout, altered trunk muscle function, and moderate evidence of bone edema and secondary cleft sign on MRI. If you're using hip strengthening for patellofemoral patients or clients, what type of results are you looking for? A new systematic review looked at the effectiveness of hip muscle strengthening. Now, 7 studies were selected. Hip muscle strengthening was found to reduce pain, improve functional capabilities in 5 of the studies. However, the studies disagreed on the treatment's ability to improve muscle strength. Now, putting it into practice, pain scores and functional capabilities may be monitored more so than hip strengthening alone. This kind of explains some of the results I've seen in practice where I would be focusing so much on strength gains when I should have been focusing on pain and functional abilities. If you see patients or clients with medial elbow pain, a new study asked the question, is medial elbow pain correlated with cubital tunnel syndrome? The study performed a retrospective review of 884 patients referred for electrodiagnostic evaluation of ulnar neuropathy. Now, 44.3% of the patients reported medial elbow pain. Here's what they found. There was actually a negative correlation between medial elbow pain and positive electrodiagnostic results for ulnar neuropathy. And the positive correlations, while they included male gender, small and ring finger numbness, ulnar intrinsic weakness, and age. Now, the study definitely changes the way I look at ulnar neuropathy these days. Got any comments? Leave them below. Also, make sure you subscribe to our YouTube channel for the latest in muscle research reviews. Thanks, and we'll see you guys the next time.